Hello guys, let's share this story at least for someone akuwe na hii experience na yeah. For the past 2 weeks I've had flu. At first nilienda nikachukua dawa and it was the over the counter. So I went, bought some drugs, bought some medicines, but nili feel like there were no changes. So I decided to visit a nearby private hospital because it was a bit late and I was feeling unwell. You just understand those symptoms. Yes, those symptoms when you have flu. It was not easy. So I went to the hospital and to my surprise, ukiwa nje, I could see like they were offering services for, and they had written that they were offering services even for those who hold the NHIF health insurance. So I stepped in because I use NHIF. I stepped in, did those, the way you use your thumb, that screening. Nikaambiwa niende the consultation room. You know, every time when you are in a hospital, of course they were using the digital means whereby your details are sent to the next room, just they are digitalized. So I was told to go to the consultation room. While going, I was told that your invoice, it will come later. They'll fill the forms and sign for me and the forms will come later. Guys, I was feeling unwell and I was alone. So unaona tu hiyo hari nikaenda kwa consultation room. The documents came, the invoice ilikuja and everything was done. From the consultation room went to the doctor's room, nikahudumiwa. I can't lie to you, it is a private hospital, but their services, I didn't like them. But anyway, did I have any other option? It was late and all that. So nikaenda, did everything, and all through I was not given my invoice. I went to three different rooms. Naenda kwa hii, did some tests, they were negative, and in every room nilikuwa naambiwa like, no, it is negative, can we try another one? I'm like, okay, let's try this. No, it is also negative. And then they're like, no, can we also try another one until nikakuwa like, no, please let us not do that. Hii tu ndio nimekujia, just help me out for me to treat this flu because hakuna kitu ingine inapatikana. So I went ahead and in the last room I asked the doctor if they can give me my invoice niende nayo. They told me no, weenda tu, invoice itakupata kwa reception. I went and now the final stage, went to pick the drugs hapo kwa pharmacist. Nikaenda nikachukua drugs, nikaambiwa niende sasa kwa reception, whereby the receptionist was supposed to log me out of my, they have to log you out because you are now done with the services. They logged me out, and after that I was expecting at least, you can't have your invoice, but at the end you are handing it to the cashier, whereby you are supposed to be at least to see this is what you are treated, this is, everything, each and every amount. That receptionist told me that no, hatupeanangi invoice, invoice yako ishaenda kwa file. Hivyo ndio niliambiwa. And now this is what came in my mind. We have had the NHIF scandal where some private hospitals zilifungwa juu zinakula pesa za watu. I shared this with my friend and what she told me was, as long as unalipiwa pesa na employer, there's no need for you to be worried, to get worried. That was just flu, guys. It was just flu, nothing else. One day, you will need this card that insurance card, whatever card you are using, be it APA, be it Britam, be it Madison, any other health insurance card, it is of importance help. One day you might have a very serious you might be diagnosed with something very serious, and that card will be of help. You might even need that hiyo usaidizi ya abroad na ikuwe inakusaidia. Don't allow anyone to use your NHIF money vile anataka, your insurance money vile anataka, because it at times get depleted, inaisha kabisa, and you need help from that. One day you'll suffer because of that. Don't allow anyone to use it anyhowly. You know, this hospital, I was at a times, I was surprised, like it was offering services to all kinds of insurances, zote zilikuwa hapo. Ukiwa nje unaona ni NHIF, but ukiingia ndani they are offering services for anyone using any kind of health insurance, zote ziko hapo. And this is just a small private hospital with a minimum number of doctors. In fact, we were so many, hadi wengine walikuwa wana left because we were so many. Like, when you enter a public hospital, laini iko hapo kubwa, watu ni wengi, daktari ni wachache and all that. That is how it was. We were so many, and yeah, the hospital yani ina offer to services na any kind of health insurance. By the way, niliboeka, and to my surprise, when I came, I didn't even check like how they charged me, and they were just those little, hizo tu vitu kidogo, unapimwa tu kitu kidogo. I don't know what they were hiding from my invoice for me to check what was there. I really don't know. And to my surprise, when I came back to the house, I decided to call the NHIF toll number. I called the office and I asked. I just went straight to the point. I've been to a hospital, a private hospital, and I didn't check my invoice. So I'll just like to check to know from the other side. I'm calling to inquire how was I charged. That guy from the NHIF office, that officer told me that from our records, it is clear that the last time you visited the hospital, ilikuwa kitambo sana. Yes, ilikuwa kitambo sana, and so from our records, hakuna mahali umekuwa kwa hospitali, and nothing has been, there is no reflection from our side. Guys, aki mimi nilishtuka na nikaboeka, because I've been sick once, and this card ilinisaidia sana. I was seriously sick, admitted for several days, and this card ilinisaidia. So if you hapo penye uko, just don't allow anyone to use that card akucharge tu vile anataka. Check out your invoices. Ask those people to give you that invoice and check how you are charged. At times, you might go to a hospital, something you are supposed to be charged 2,000. Utapata wamekucharge even 10,000. Even more than that, and you have no idea, because they will not show you how you are charged and all those services that you got from there. At times, unaweza pata wameandika hata services haukuwa served from them. Be careful. Be very careful.